Hi everybody, I'm Brent Stafford and welcome to another edition of RegWatch by RegulatorWatch.com. We're here in Warsaw, Poland for the 12th edition of the Global Forum on Nicotine, which is the annual conference on safer nicotine products and tobacco harm reduction. In today's episode, we're going to have a conversation with Dr. Pritika Kumar, who is the U.S. Director of Scientific Engagement at Philip Morris International. She focuses on science-based communication and regulatory engagement in the U.S. market. Dr. Kumar, thanks for coming on the show.
Thank you for having me.
So you are, let me get this correct, the Director of Scientific Engagement for the U.S. at PMI.
Yes.
So what exactly do you do?
So at PMI, I lead the U.S. At the U.S. Scientific Engagement Group, and it really means translating complex evidence about nicotine and smoke-free alternatives into accessible insights for our stakeholders. Me and my team, we also make sure that we communicate our science with integrity and clarity and in a way that contributes meaningfully to the broader dialogue of tobacco harm reduction.
So, and that's, with the FDA, I guess, is the main recipient?
Well, FDA is one of our key stakeholders, but we also look at our consumers as our stakeholders, even though we do not directly communicate with them. We feel policymakers, regulators, healthcare professionals, academics, research community, they're all our stakeholders. We go through the due regulatory process, which is not an easy task. It takes hundreds and thousands of scientific documents to be submitted and studies to be conducted at a very, very rigorous level, and we do all of that.
And you've done that actually quite well. You've got IQOS has got a marketing granted order, is that what it is?
Yes. So we have both the marketing granted order and we have a modified risk tobacco product authorization for our IQOS product.
What can you say about the ZYN application that just recently came out?
Yes, so earlier this year, we received the PMTA, which is the pre-market authorization for our ZYN products, all 20 flavors. And what the recent announcement is that the scientific review for the modified risk tobacco product application that we have in has started.
So the modified risk tobacco order, what does that actually allow you to do?
Yes, that's a great question. So a modified risk tobacco product order is really a milestone that allows us to communicate certainly the certain scientifically substantiated claims about reduced risk or reduced exposure. So I'll give you an example. One of our products, which is General Snus from Swedish Match, that was the first to receive both pre-market tobacco authorization as well as modified risk tobacco product authorization from the FDA. And what really that allows us to do is speak directly to the consumer about the risk claim of that product. So for example, I will read it out here. It says, using General Snus instead of cigarettes puts you at a lower risk of mouth cancer, heart disease, lung cancer, stroke, emphysema, and chronic bronchitis. And so that's what it really means. And then earlier this year, FDA renewed the MRTP for General Snus. All of this really is based on decades of epidemiological data that we have from Sweden and confirmed by the US data, which resulted in a standard-setting 8-year grant to use a reduced risk claim for that product. Then for our IQOS product, we have the modified risk tobacco product authorization as well. And in that particular case, it has authorized us to say that switching completely from cigarettes to the IQOS product significantly reduces your exposure to harmful and potentially harmful chemicals that are related to cigarettes, right? And so that's a reduced exposure claim that we have. Also known as the G2 claim. So those communications are tightly regulated and they are based on the totality of scientific evidence that the FDA validates independently through their review process.
Yeah, very few companies have the ability to make those health claims.
Well, it is a very, very rigorous process to go through. And so yes, which is why very few companies have that.
How much scientific evidence is needed to get over that hurdle?
A lot. In short. So we have to do toxicological assessments, clinical trials, we do behavioral assessments, perception assessments. So right from, it's something that we call the totality of evidence framework. So right from the time that the product is designed till the time, even after the product goes to the market, our studies don't stop, because even once the product hits the market, we continue doing post-market surveillance on our products, because we take the regulatory process very seriously, and we know that the authorization that we are given at one day can be also taken away if we don't really follow the due process. And so our studies are extremely rigorous, right from toxicological assessments to post-market surveillance.
So as I've said many times on RegWatch, Dr. Kumar, if PMI science is good enough for the FDA to issue marketing and modified risk orders, why isn't it good enough for the Lancet or BMJ?
I feel that it's a very fair and a very necessary question. The disconnect between regulatory acceptance and academic gatekeeping, it does need to be addressed. Right, peer-reviewed journals are crucial for validation and for disseminating knowledge. But when they categorically exclude research that has been done to very rigorous standards, that's when they are doing disservice to an evidence-based discourse. Right? People, especially some of our academic stakeholders, their memories are frozen in time when it comes to tobacco industry, right? But as a company, we have a commitment to a smoke-free future. So what we believe in doing is in consistent, rigorous data sharing and transparency, and that's something that we'll continue to push forward. When it comes to academic gatekeeping, why I say it is a disservice is because, as you know, and as I shared earlier, the science that we have to do to submit to FDA as a part of our applications is more than rigorous, right? It's extremely rigorous. And so I feel that people deserve to get that science and be able to see that science. Healthcare providers, we just wrapped up a study on healthcare providers, almost 1,600 healthcare providers in the country, nationally, all over. And we found that healthcare providers really regard peer-reviewed journals as a trusted source of information. And if this science is not getting to peer-reviewed journals, then that is a disservice.
What did you find in that survey?
So this was a study that we commissioned to an independent research organization called Povado. And they surveyed 1,565 healthcare providers across 9 specialties all over the US. And the 9 specialties were primary healthcare providers, cardiologists, pulmonologists, oncologists, psychiatrists, dentists, licensed clinical social workers who work in addiction space, and mental health nurses and general nurses. So there's a study that Rutgers did about 4 years ago with about 1,000 physicians and across 6 specialties. And so we felt that this was the right time to do this study, because that study was getting dated. And also we feel that understanding the knowledge gaps of the providers is the first step to understanding what is the support that they need, where are the blind spots, and how can they provide the support to adults who smoke.
And so what were the findings in terms of their knowledge?
So the scope of the study really was to assess the knowledge, perceptions, and the clinical behaviors of healthcare providers related to tobacco and nicotine. And we felt that this was the right time to do this study because providers are on the front lines of combustible tobacco use screening and treatment. So yet many are navigating conflicting messages that they're getting, right, from different sources. So understanding their knowledge gaps is the first step in designing tools, in training and policy that supports science-based clinical guidance.
So what are their perceptions on nicotine?
Yes, our study revealed that over 2/3 of the healthcare providers, of the US healthcare professionals that we surveyed, are either uncertain or they mistakenly believe that nicotine causes cancer. Now, this is deeply concerning because nicotine, while it's not benign, it's not risk-free, it's addictive, it's not the primary cause of cancer. What really is the primary cause of cancer when it comes to smoking is the combustion, right? Now, that distinction is critical. Misconceptions like this can lead to missed opportunities when it comes to educating the patients about reduced risk alternatives, for example. Clinicians are some of the most trusted voices in healthcare. But if they are unsure about what is the true driver of death and disease when it comes to smoking, they are not going to translate that knowledge or they're not going to pass it on to their patients. They're going to be hesitant, right? And so when they're unsure, how can we expect that they are going to pass it on to their patients?
So, Dr. Kumar, 2/3 of the providers either believe that nicotine causes cancer or aren't sure. How could this level of misinformation still exist among medical professionals?
That's a great question. It's a systemic issue. It's a systemic issue of decades of conflated messaging around nicotine and smoking. While public health campaigns have done a great job in creating, messaging around the harms of smoking, they haven't done a great job in separating nicotine from smoking, right? And so while smoking is addictive, it is not the cause of cancer, lung disease, respiratory disease. And so that distinction has not been consistently made and that has not been consistently emphasized in medical education either. So what that has led to is confusion, persistent confusion among healthcare providers about nicotine.
Yeah, that's amazing. So what impact then does this have on patient counseling?
Yes, I mean, if clinicians are misunderstand nicotine, then they may discourage their patients from using reduced risk alternatives, non-combustible alternatives, regulated non-combustible alternatives. And so we are also aware, and it has been well documented, that nicotine replacement therapies are not the most effective when it comes to helping people quit and stay quit. So in that case, other harm reduction options such as non-combustible alternatives come into play, right? And so our study found that while providers have a high self-reported familiarity of different non-combustible products, they're hesitant in talking about these products with their patients because of that lack of clarity.
So where do they want to get their information from then?
That's a great question, and we asked this question in our survey as well. So the most trusted voice when it comes to tobacco nicotine products for healthcare providers is FDA, CDC, medical associations, and peer-reviewed journals. These were the top 4 sources. But we also know that all these 4 sources don't always have harmonized messaging when it comes to talking about nicotine and non-combustible products.
And relative risk.
And relative risk, yes.
Yeah, why is that?
Well, the FDA has been very clear about the fact that all tobacco nicotine products lie on a spectrum, right? And what they call it is a risk continuum. So with cigarettes being the most harmful, the combustibles, and the least harmful thing really is to not use anything. Now, what lies in the middle of that continuum is non-combustible tobacco nicotine products, right? And when you see, I don't know if you've seen this visual, if this is a spectrum and the risk from combustible tobacco use is way up here, when you see that, so the risk from no use is 0. When you see that drop in risk from using non-combustible tobacco products, it's not a continuum anymore, it's a risk cliff, right? That delta is huge. But unfortunately, other sources, such as the other trusted sources for medical associations, for example, they don't always speak the same language as the FDA.
So, Dr. Kumar, the healthcare practitioners that were in your study, do they understand the continuum of risk?
Most providers conceptually understand that all tobacco and nicotine products do not pose the same level of risk. However, there seems to be a gap between that theoretical understanding and how that translates into practice. Now, those barriers could include misinformation, lack of trusted resources, limited regulatory know-how. Providers said that they don't really know how many products have been authorized or how these products are authorized or which are these products that have been authorized. So there is a lot of gray area that they're not aware of. So we found that fewer than 1 in 5 physicians felt confident in counseling their patients on the comparative risks between cigarettes and the non-combustible alternatives.
Right.
So we know that risk is not an on and off switch, right? It is a continuum. And people deserve to know where they are on that continuum. Now, we treat risk like a light switch, on and off, right? If something is safe or it's not safe, something is good or it's bad, but that's not how science works. Right. And so the difference between cigarettes and smoke-free products, and that difference is not trivial, especially for a person who smokes. They need to know that. So when we communicate risk as an all or none, right, we remove people's ability to make informed and balanced choices. Understanding relative risk it's not just good science, it's just good public health.
So the healthcare providers certainly are not immune to misperceptions and the fear-driven media narratives that are around nicotine. So, but is part of the problem like the lack of clear guidance? They're not getting it.
So what our providers communicated to us through this survey is that over 90% said that FDA has an obligation to communicate to them if a product is less harmful than smoking. And 95% said that if FDA communicates this guidance to us, we are willing to share this guidance with our patients, right? Most of the providers in our study, they said that they want FDA to offer clear clinical evidence on smoke-free products, and they want formal guidance on how to counsel patients on these products.
I think the entire vaping industry in the US would agree with you.
Yeah, absolutely. I mean, it just signals a clear call from the front lines, right? I mean, they are saying that we want tools, we want to get informed, we want science-based care that we want to provide to our patients, but we want the FDA to provide that to us.
Dr. Kumar, globally, PMI has made a commitment to transition your business to smoke-free products. What was that commitment and how far along are you?
Well, PMI's transformation is one of the most ambitious in the industry. We've invested over $14 billion in science, innovation, and infrastructure that's needed to shift away from cigarettes. Now, that 42% figure, it just does not represent a financial milestone for us. It represents a public health opportunity.
So 42% of your revenue is now from smoke-free products?
Yes. 42% of our global net revenues come from our smoke-free portfolio.
That's amazing.
Right, and our goal is a smoke-free future. And every percentage that we move away from cigarettes is a step closer to that vision.
So if you look ahead, what could stall or stop the transition in the US?
Well, what could stall is misinformation, regulatory uncertainty, institutional resistance to new models of tobacco control. If clinicians, regulators, or public health voices continue to conflate nicotine with smoking, it's not only going to stall that progress, but it's going to reverse the progress that has been made, right? And so, on the other hand, what could really supercharge it is aligned action. That harmonized voice that I was talking about, clear FDA guidance, clinician education, access to alternatives, and an honest public conversation about the risks, but without the stigma, right? So if we meet people where they are, right, with the tools that work, we can accelerate that shift away from cigarettes.
Goldman Sachs even predicts that reduced risk products could overtake combustible sales by volume this year. Do you see this shift as a confirmation of PMI's long-term strategy to move out of the combustible business?
Yes, these trends strongly validate our transformation strategy. People are already making the shift, often without formal support or encouragement. right? Our job is to ensure that they have access to better products that are rooted in science and that have been regulated responsibly. The fact that millions of adults are already choosing smoke-free options just tells us that innovation backed by evidence can change behavior at scale, right? It can impact public health at scale. So that's exactly the future that PMI is working toward.